maternal health, I think, when you're really looking at, to me, what anything Black is in the constructs of America, it's something intentional. Like, it means something other than just maternal health, which is, women giving birth to children and all that comes with that, the pregnancy and the labor and after. But in the aspect of Black maternal health, now it's like, well, what is the Black part, right? And so the Black part to me is the revolutionary part. It's the part of maternal health in and of itself being a model that has been created to serve mostly white women, and hasn't really created, it hasn't been created in the construct to really support all the aspects of Black women as they're birthing. And so it's a very individualized model. It's not very community-based. It's very much intertwined with health and physical and body, and not so much about spirituality and relationships and the softer, sensitive, intuitive, connected side of life in maternity. That is what I experience when I'm talking with Black mothers about birthing. We're not talking about just what our bodies are doing. And if I seek the aid of a Black maternal health specialist, even as one myself, like the conversation that they have with me and that we have together and that I have with clients is about themselves as a whole person and what they're needing emotionally. It's a lot more about the support on the emotional level, because the body does what it does naturally, and so everything could follow from that. And that's very much, to me, the energy that Black maternal health comes with, which is very different than the model of maternal health in the world, which is very like your body and pretty fear-based culture of, well, these are the things that could go wrong, so do this, and then read this book. It's very regimented. It's not the way most of the Black women that I know and that I work with live their lives, or want to approach it. And so they sort of kind of force into this model that doesn't really match. And so Black maternal health is, like I said, it's revolutionary. It's an opposition, I think, to some degree, to the standard of maternal health as it is. It's a statement in some ways to say that there is something needed other than what the world is having for other women, and that it's something that Black women need to assert for themselves, that we know what we need, or that we can figure that out among ourselves, since this the general population really, I mean, how can somebody meet needs that they don't even know exist? And why when we have thousands of Black midwives and thousands of Black doulas and thousands of Black maternal health support people? Not that we couldn't exist in a model with other people, and certainly, especially in the work that I do, I mean, we have a lot of alliances with Latina women, we have a lot of alliances with white women, with Asian women, with Native women. I mean, it's a beautiful team of women in alliance, but it has to be from the platform that there is something unique about the Black mother, and that she needs something unique, not deficient, not because there's something wrong, but because she has a lot more in her life and a lot more influences to her maternal health than the average woman, whatever that means.